What are my rights regarding confidentiality?
Whenever you see a doctor or a nurse or an allied health professional, they are actually bound by their colleges to keep the information that you tell them confidential. But there may be some reasons why they need to ask your permission to transfer some of that information. So for example, if you're having part of your care with me, but you're also going to be seeing a specialist in a different city, well, it's in your best interest if we share information about you. So if you've had problems with previous medications, if you've got any allergies, clearly it's a sensible idea to talk to them. Now, in almost every circumstance, I will ask your permission, is it okay to give this piece of information to this person? But sometimes it'll be in your best interest if I just give the information. And that's, for example, if you were injured in a bus accident and you were unconscious, well, clearly for an emergency, somebody might ring me up on the phone and say, I need the information now. And it's also if you've told me something which endangers you or endangers people around you. So sometimes, for example, people with mental illness might tell their doctor that they're thinking about suicide or that they're thinking about injuring other people. Now, in that respect, I then have a duty of care to make sure that that's notified so that you can get the best care for you, but also so we keep other people safe. And I guess from drug and alcohol perspective, sometimes people are a bit nervous about approaching healthcare professionals because they're worried particularly about their children. It's not a problem. If you're seeking good treatment for your drug and alcohol problem, that doesn't mean that your children will automatically be taken away or anything like that, because somebody who's in treatment is actually safer, their children are safer, than if they're not in care. But if you were, for example, seeking treatment, but at the same time telling me that you had visitors to your house that were violent or there was domestic violence in the household, that's something separate again, and that does increase the risk for children. And there might also be things that you would tell me that would mean, like for example, that you couldn't afford to buy food for yourself and your family. And that's where it would be appropriate for me to talk to Department of Community Services and make sure that you got the help you needed. I would always discuss that with you as well. But if the children are at risk, I actually don't have any choice. I must. It's a mandated behaviour. I must get the help for them.